If you start to look around at any non-surgical facial treatments, you will know that there's a ton of stuff out there. And guess what? Most of it doesn't work. It's being sold to you to try and spend your money on junk that doesn't work. In this episode of the Trillium Show, we're going to go over the world of facial rejuvenation, treatments to save your money on and not bother wasting money, wasting time, and potentially having complications when you're really not going to see a result. Welcome to the Trillium Show. I'm your host, Dr. Jason Hall. I'm the medical director of Trillium Aesthetics and Trillium Plastic Surgery here in Knoxville, Tennessee. And the goal of this show is to help you keep from spending your hard-earned money on crap that doesn't work. Now, there are an overwhelming number of cosmetic, non-surgical treatments that are available for facial rejuvenation. And the purpose of this show is to help you avoid overpriced, ineffective, or risky treatments. And this is based on results, safety, and my experience over a number of years in this field, in my experience over a decade and a half in this field, and patient satisfaction of these treatments over time. So the first section we're going to cover is overpriced treatments that don't deliver on their promises. In this group, we're going to talk about a number of different things. First one of these are these electromagnetic muscle stimulation treatments. You'll hear them used by trade names, Emsculpt being one of them. And what these are supposed to do is use electromagnetic energy to stimulate muscle contractions. And these muscle contractions, you think about it as a kind of a workout that isn't. They have these pads that can go on your cheeks, that can go on your forehead and your chin. They've got bigger pads that can go on your body. And the idea is that we stimulate muscle contractions, we build muscle, and at the same time reduce fat and slim your face, neck, or any other area of your body. Why we need to avoid these is that we know that that doesn't work. Trying to locally build muscle and lose fat doesn't work. Otherwise, we'd all do sit-ups and we'd all have six-pack abs. It just is a total fallacy. The other reason it doesn't work, especially in the face, is that loss of muscle tone is not the reason that we end up developing jowls or a saggy neck or droopy eyebrows. It's not that the muscles have gotten weak and have gotten loose. It's that that overall tissue quality has decreased over time, which happens with everybody, and gravity starts to take hold. The electromagnetic muscle stimulation devices are one of these that have been looked at in our journals. And there was a paper, a very good thinking plastic surgeon named Dr. Swanson did a study on this, looking at results of these electromagnetic stimulation technologies in the body. And what he found over time is that these things decrease fat by about 1 millimeter, increase muscle by maybe 1 millimeter. And so you get that much improvement in your whole abdomen, which is almost undiscernible for thousands of dollars that these things cost. It's multiple treatments. Now they don't hurt. You're in and out, but it is a huge waste of time and money. And I will talk a lot in coming shows about my thoughts on the site realself.com. I think it's next to worthless and is a scam for patients and for surgeons. But they do have one valuable piece of information on there, what's called the Worth It score. And patients go in that have had treatments or had other surgeries and things like that, and they rate the results of their treatments. And across the board, the Worth It score on RealSelf for these electromagnetic muscle stimulation technologies is incredibly low. People say it is not worth the money that they spent at all for the result that they get. So avoid these electromagnetic muscle stimulation technologies. And I've done a podcast, we'll link to it here, talking about that earlier in the year. If you are interested in muscle toning and in fat reduction, a good alternative would be the tried and true methods. If you want to build muscle, exercise. If you want to try and build muscle in your neck and in your face, these kind of facial slimming exercises, knock yourself out. They don't work real well because muscle sagging isn't one of the reasons we end up getting jowls and neck laxity, but knock yourself out. It's certainly not going to hurt you. It's free, but don't expect a big result. And for fat reduction, traditional surgical treatments, liposuction, or even face and neck surgery to help contour some of that is a much better option for you. So number 2 in the overpriced treatments that don't deliver is full facial rejuvenation with injectable hyaluronic acid gel fillers. And this is one of those treatments that a little bit is good doesn't mean a lot is better. The idea behind full face rejuvenation with HA gel fillers, or what you see online is facial rebalancing, is that we want to replace volume and try and recontour your entire face in one sitting or a couple of sittings to help smooth out some of the contours. And while this is nice in theory, if you have gone back and listened to me talk about how the face ages, again, we'll link to that podcast episode here, volume loss is one of multiple reasons that we start to look old over time. The others being skin damage over time and just gravitational changes in tissue laxity. So trying to reinflate to compensate for poor quality skin and poor quality soft tissue isn't going to work. And this is what leads to this kind of alien look, this puffy, unnatural appearance that you see in magazines. You see, hopefully you don't see it in your friends, but there are a lot of people walking around that have got way too much filler in their face, and it starts to look unnatural. Movements are unnatural, expressions are unnatural, and it's a dead giveaway. You're trying to compensate for something and not doing a great job for it. The other reason is that it's really expensive. Full facial rejuvenation is $4,000, $5,000, $6,000 worth of injectables. And for a lot of people, you're not going to see the for the amount of money that you spend. On Real Self, the worth it score for these is mixed, as you would expect. A lot of people feel that their result is not worth the price that they've paid. There are also some people that are very happy. These are typically patients, and in my practice, people who we have done multiple syringes of filler to help rebalance things, typically tend to be on the younger side and don't have a whole lot that needs to be corrected on the front end. And I think the thing to know is that with these treatments that you're getting a partial treatment, and you really need to kind of have a very candid discussion with your injector about what your outcome will likely be, and then make a value-based decision for yourself. Better alternatives to that is combining small doses of fillers with other treatments, with good medical grade skincare, with RF treatments, with laser, even with surgery, to help address those 3 main components of facial aging at the same time, and developing a long-term plan to help you get to where you want to be. So the next section of things to save your money on are treatments with high complication rates. And this section really centers on treatments that are really not good ideas to start with. The first of these being thread lifts. Now, thread lifts are not new. Thread lifts have been around for at least 20 or 30 years. The first ones, and what a thread lift does is it uses threads that are inserted into your face using relatively long needles under local anesthesia, and then we pull on those threads and get them to anchor in different places to try and lift and resuspend the soft tissues of the face that have sagged over time. The early thread lifts had tons of problems because the sutures that we were using were permanent sutures, and they ended up either getting infected. In some cases, they eroded through people's skin and left these linear scars. And the results were, as you can imagine, not what people wanted. About 10 or 15 years ago, after almost dying, the thread lifts kind of were reborn with the use of dissolving sutures, which are all things that we use in surgery that had little barbs on them, and they kind of made a comeback. The problem with these now we don't have the problem with erosion that we had in the past. At least I haven't seen it, but they don't last. These are, you may get a nice result for a couple of weeks, but the results are very short-lived, and you can kind of measure your improvement in a weeks to months improvement for a couple of $1,000s for a full face treatment. The results can be uneven. They can hurt. Again, the threads can get infected, and really just is not a great treatment to resuspend sagging soft tissues. The idea is there that's treating one of the three components of facial aging, but not well. On Real Self, worth it scores tend to be really low for these, mainly due to the short duration of the result and the complications. If we're going to consider alternatives to thread lifting, there are things like radiofrequency microneedling, which has really taken off as a good treatment, not necessarily to tighten, although what you see in the mirror looks like tightening, but improving your skin quality, causing you to build more collagen, build more elastin, improve the overall elasticity of your skin, which looks like skin tightening on the surface. And then injectable collagen building treatments like Sculptra. Those would be good alternatives if we wanted to have a non-surgical alternative to thread lifts. Our second therapy in this high complication rate is focused ultrasound, which goes by the name of therapy out there. And how it works is using focused ultrasound energy to try and stimulate collagen production and help tighten skin. And this has been around for a while. It is exceedingly painful, and the risk of nerve damage, the risk of asymmetries is fairly high. And what we've seen is that the results of focused ultrasound treatment really have consistently underdelivered. You don't see these treatments being offered much anymore because of how poorly they actually worked. On Real Self, the worth it scores tend to be mixed or low, with a lot of patients complaining about the cost and the discomfort, and then noting at the same time they offered very little improvement to the areas, mostly the neck and jawline, that they treated. Again, better alternatives for this would be radiofrequency microneedling, or fractional lasers, both of which can accomplish the same thing in a much safer, more predictable fashion. The third section in this Save Your Money On show revolves around ineffective or overhyped over-the-counter products. There are tons. You go in Sephora, you go in Ulta, you go in any of these stores, and there are absolutely tons of neck creams, eye creams, tightening creams, lightening creams that promise drastic results and promise to help turn back the clock on the facial aging process, and in reality deliver very minimal changes, especially with deep wrinkles, with significant skin sagging, with significant pigment deposits, all of which are the result of a lifetime of skin damage. We've talked a little bit about over-the-counter products before. The problem with them is that they contain a low concentration of active ingredient, or they rely on marketing hype, rather than proven science to give a result. Now, for the Real Self Worth It score, you really don't see a whole lot there. The skincare products aren't really rated. It's mostly plastic surgery and non-surgical treatments. But talking to patients day in and day out, the people come and sit in our offices every single day because they've been trying everything under the sun and have a bathroom full of skincare products that they purchased at some of these big box stores, and they haven't done anything. They haven't seen any results at all. So better alternatives are consult with a professional, with a board certified plastic surgeon, with a dermatologist. Talk to your trusted esthetician and develop a long-term skincare plan with medical grade skincare products or treatments such as topical retinoids, vitamin C serums, topical growth factors, chemical peels that require someone else to do them for you, not these over-the-counter peels you do at home, or lasers. But having a good long-term medical grade skincare product and treatment plan is a far better alternative to going and spending hundreds of dollars on products with really no science behind them, but lots and lots of marketing behind. And this kind of brings us to how to choose treatments wisely. And I think the biggest thing that I can encourage you, if you're interested in making cosmetic improvements, is to do your research and have realistic expectations. You really need to dig deep into reviews of places that you're going. Dig deep into researching treatments on public sites, Reddit, RealSelf, Instagram, and look at before and after photos from people who are actually doing the treatments. If you're looking at before and after pictures on Dr. Joe Smith's website, and at the bottom of the picture, you see photo courtesy of Dr. Bill Williams stamped on the bottom of the picture, what that means is that photograph was very likely supplied by the manufacturer of whatever device that you're researching on that clinic or physician's website. Those are not that person's results. Those are results that were provided to them by the equipment manufacturer, which are always good. That's why they're the before and after device. That's why they're the before and after photos that they use to sell those machines to us. And so we turn around believing the marketing hype and use those to sell those treatments to you. And so especially for cosmetic treatments, you want to see before and after pictures from the people who are going to be doing your treatment before you fork over any money or sign on the dotted line to have a treatment done. You want to ask them how long, when were those photos taken? How long did those results last? And then get a lot more details about the treatment itself. The other thing is that it's important especially when we're talking about non-surgical treatments, that you don't go into a non-surgical treatment expecting a surgical result. Now, with skincare, what that can mean is don't expect your topical skincare products, even medical grade skincare products, to give you the same result in skin tone, skin texture, pigment that you would get from a laser treatment, from a series of RF microneedling treatments. Your topical products will not do that. At the same time, don't expect your non-surgical cosmetic treatments, your radiofrequency microneedling, your laser treatments, to give you the result that you would get from a face or neck lift. First of all, we're doing two different things, but second of all, we are, your result from surgery in a lot of these cases is going to be orders of magnitude better than your non-surgical treatment. For your non-surgical treatment, a lot of the times, and I tell patients in the office this almost every day, part of what you're paying for with a non-surgical treatment, even one that works and does what we tell you it's going to do and we expect it to do, part of what you're paying is you're paying to stay off the operating table. You're not paying for an equivalent result. So don't, make sure you understand that before you sign on the dotted line for any one of these treatments. And that's why it's really important when you are looking for treatments, when you're researching, that you sit down with a trusted professional to get an unbiased opinion on treatments, which ones work, which ones are worth the time, the money, the risk, and which ones aren't. And if you're only getting steered in one direction without addressing the other potential treatments that are out there, then that ought to raise a red flag to you that you may not be getting the whole story. So ask about things like surgery. Is this, especially when you're talking with fillers, is this something that would be better corrected with surgery? Is the neck laxity that I don't like, is this something that we can do a little bit of radio frequency, maybe a little injection along the jawline to help camouflage and hide it? Or is this something that I'm going to get a ho-hum result, and maybe thinking about surgery is something we ought to consider? The other thing is that you want to avoid the, too good to be true solutions. Really be careful of any trendy or celebrity endorsed treatments that don't have a lot of solid scientific backing behind them. And this is something that comes up in consultation, and ask the person that you're sitting down with discussing these treatments that you've seen online or you've read about, whether they're really, the marketing hype behind them, which is substantial, is really backed by results in their hands. So what you really want to do is invest in things that work. You want to invest in treatments that have shown results over time, that have work well in the hands of the person who's doing the treatments or who's recommending them, rather than wasting time and money on overhyped procedures. I'm going to link right here to the facial aging podcast that I did. It's really important if you're even thinking about starting down the pathway of surgical or non-surgical treatments to address facial aging, to understand how you age, why you're seeing what you're seeing in the mirror, so that then you can make informed decisions for yourself about whether what you're hearing jives with what you're seeing. One thing I would encourage you is that it is really important to focus, once you make the decision to go down the road of pursuing facial rejuvenation treatments, to focus on long-term skin health and well-being, and not looking for quick fixes that you'll either end up disappointed or will end up having complications that can be very challenging, if not impossible, to fix. So I thank you all for listening. If you have any questions, any comments, please leave them below. Always happy to answer those. Thanks for listening, and we'll see you again soon.